At this time, I'll call the August Board of Commissioners meeting to order, and I'll ask Commissioner Langley to do the invocation and Commissioner Rebolts to do the pledge. Please stand.
Let us pray. Eternal God, our Father, we are grateful and thankful for the opportunity to assemble together one more time to do the business of your people. Father, lead us and guide us in the right direction as we do what is best for your people. In Jesus' name we pray. Amen. Amen.
Please face the flag. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, I'll ask that if you have a phone with you, please either cut it off or put it in silent mode. We're down to item number C, conflict of interest. Does anyone have a conflict with any of the agenda items? Hearing none, we'll move to the public comments and remind you there is a 3-minute limit. If you will, introduce yourself when you come up. And the first one, Maurice.
Mr. Chairman, did you skip the approval of the agenda?
I did, but
But we can
We can do it after.
we'll do it after the public comment.
Good evening, Mr. Chairman, Commissioners. My name is Maurice Elliott, and I've been asked to represent the residents and property owners of 2 residential communities located along NC 33 on the south side of Beaufort County in the extreme eastern end. These 2 communities, Windsong 2 and Windsong 3, were established in the late 90s as waterfront communities on Campbell Creek. Our development began about the same time as the original development, known simply as Windsong. We're here tonight in support of our earlier request for this board to utilize part of the monies that Beaufort County is being allocated through the American Rescue Plan, ARP, to extend the county water lines into our communities as has been done previously in Windsong. When the water lines were run into Windsong, the main line that extends down 33 East was stopped at the entrance to Windsong. We're asking that this line be extended the extra 0.6 of a mile to include Windsong 2 and Windsong 3, and that the lines be run into both developments. While we fully believe this would be an allowable use of the ARP monies, we also recognize that we're asking the county for a significant outlay of resources. However, we also believe that the county would be able to recoup some of these outlay through tap-on fees and higher monthly basic water charges, as has been done in other areas such as Jarvis Landing. Currently, in both developments, there's a total of 42 residential lots that would potentially need meters. Of these, 13 have homes that are already occupied, with an additional 4 lots being prepared for construction. At present, the only sources of potable water in these 2 communities are our individual wells. Because the water that comes directly from these wells has a slight odor and tea color, we must each invest in our own water treatment systems in order to make the water more palatable. While this has proven satisfactory thus far, there are other factors that have impacted the suitability of our drinking water in the past and will continue to do so in the future. For example, the extensive flooding caused by Hurricane Irene contaminated all of our wells. Since then, several of us have had the wells contaminated by other storms and high water, which requires us to have the county to perform water quality tests as well as to secure services of someone to sanitize these wells. Add to this the stress placed on the Castle Hayne Aquifer by other significant water removals operations, and we believe it's only a matter of time before we see drastic reductions in the availability of potable water to our homes. As a health issue, the availability of clean drinking water is undeniable. However, we believe it is also an economic development issue. Just as industry requires clean water, obviously so does a community's residents. The availability of a reliable and safe source of drinking water increases the potential for new homeowners who are looking for property on which to raise their families or on which to retire. In turn, this raises property values and therefore improves the revenue potential for the local government. We believe this to be a win-win proposition. In closing, I just want to add that we're all happy to be part of Beaufort County. The residents in both communities are active participants in the county. We all vote in every election in which we're eligible to vote, and last year, both communities accounted for over $54,000 in property taxes. We're asking, however, to be more fully integrated into the county, particularly as it pertains to services in our part of the county. We believe that the extension of county water would be an important first step in this process. Thank you for the opportunity to address you all tonight, and thank you in advance for your consideration in this matter.
Thank you very much. Dawn?
Hello, my name is Dawn Brinson Slan. I'm a resident of Beaufort County, a small business owner and a taxpayer. I'm sure all of you know by now that Beaufort County schools will be making masks optional for the 21-22 school year. This was part of a unanimous decision by the school board last week. Elected individuals exhibiting a spirit of working together with the best interest of the children, teachers, and school system employees of Beaufort County at the forefront. While I realize this decision is subject to change if the governor decides to pen another executive order at will, in the short term, the right to choose is protected. Just like the school board, this committee of commissioners is elected by the people of Beaufort County to carry out the business of the county in a way that benefits the citizens of the county. That is how I understand it. I recently attended a meeting with a subset of this committee to understand more about why these individuals feel we need a county police force in addition to the city police and sheriff department. After listening to the information provided, the only thing that is clear is that the subcommittee is looking to find a way to control how law enforcement of the county is carried out. I quote, "The county sheriff is a constitutional officer elected by the people and bound by oath as guardian of the people's unalienable rights secured by the Constitution," end quote. Unlike any other hired police force that answers to commissioners or local leaders, the sheriff answers to the people, not to anyone else. A hired police force are supposed to protect the people, but they have to do so based on specific codes and guidelines. While I appreciate the city police department, I am glad to have someone that will protect our constitutional rights. I can appreciate the effort to look into resources to support local law enforcement, including the sheriff's office. However, I cannot appreciate an initiative that is pulled together using sweeping negative comments made without reference or documentation to support them, single instances of situations shared without facts, and opinions presented as fact. As a taxpayer, I am requesting that the items presented in the County Police Committee meeting held on July 22nd be provided to the Beaufort County Sheriff's Office for review and input. If all of those things are true, then there are provisions that enable the people of Beaufort County to evaluate the sheriff and, if required after due process, remove them from office. Unless there are actions that have not been brought to light, I do not see any valid or beneficial reason for the addition of another law enforcement group to be added to the payroll of Beaufort County. I do see tremendous need for the members of the County Police Force Committee to provide facts and concrete examples of how the sheriff and members of his department have failed the people of Beaufort County. In the meantime, I encourage the people of Beaufort County to spend some time educating themselves in the activities of the Sheriff's Department and the County Police Force Committee to understand if there are true concerns that should be addressed. I am aware that there is an election coming up, but I will remind you that while you can change the individual in charge, you cannot alter the remit of the office and who they answer to. Thank you.
Thank you. Dot?
That's some very important news for you guys.
I apologize.
You apologize for?
Yeah, it went off as you were trying to say something.
Anyway, I have something very important to tell you and to request. If it's necessary to use the ARP funds, I would like to request that. See this little bottle? Whenever I come to the commissioners' meetings, I always want water before I get home. There's nothing in the ladies' room, and I even checked the men's room. There's nothing in there that allows me to get a cup of water, so I brought my own. So I wonder if we could use some of those funds that we're getting from the government to put a water faucet of some sort in this facility. Thank you very much. Have a good evening. If you need a drink of water, I've got one.
You've been good, Don.
Thank you. Thank you, Dot. Okay. Okay, we're down to approval of the agenda. Could I have a motion to approve the agenda? Yes.
Before we do that, I have a couple of questions about the agenda.
Okay.
We requested a report from the sheriff at the last meeting to be presented at this meeting on contacts that were made, and I just want to be sure. The sheriff did not submit a report, is that correct?
That's correct, sir. The request was made and I did not receive it.
Yeah, because I don't see anything on the agenda having to do with that. So I would like to make that an additional agenda item for short comment tonight. In addition to that, I would like a short session on immigration added to the agenda.
Okay, we went through this adding to the agenda and changed that. Back to our original policy, remind me, Katie, is it 3 days before?
I think it's 5 o'clock on the Monday prior. to
Okay.
the-
Mr. Chairman, you're confused.
I thought you were adding
No,
an agenda
You're
item.
confused about our policy.
What, she just stated what it was.
No, she didn't.
She did.
It's 3 days before if an individual commissioner wants to put something on the agenda without objection.
Okay,
This board can change the agenda sitting here without anyone having to have a time limit. It comes before the board. We've done it many times. There's a large precedent for this.
okay. You want to make a motion?
Well, yes, I move that we include a discussion about the sheriff's lack of reporting
And immigration.
and on immigration as two separate subjects, that
Okay.
they be added to the agenda for tonight.
Is there a second?
Mr. Chairman,
Yes.
can I bring to you real quick, as you get ready to vote on this, just so you understand, according to your rules of procedure, Rule 9, Item C, you can add that in an emergency item, but it takes a 5-2 vote approving the item for that to be approved at this date, according to your agenda, according to your rules of procedure.
Does it have to be an emergency item? Is that,
It says, "No item will be considered for purposes of taking action by the Board of Commissioners unless it is in the Commissioner's hands 3 days prior to any meeting, with the exception of special called meetings, or to take up an emergency item with a 5-2 vote approving the item." So if it's not in the board's hands 3 days prior to the meeting, for it to be added to the agenda at the meeting, this reads that it would be considered an emergency item and would need a 5-2 vote.
No.
That's your procedure.
I have an objection to that because we add items to the agenda sitting here at the meeting. People walk in all the time. If you want an item on the agenda, it has to be in the commissioner's hands 3 days before the meeting. But you can't tell me that a board like this can sit here and meet with our hands bound, not being able to take up a late item that could be actually an emergency item or something else. It just doesn't work that way. And we've never done it that way, and we have added items to the agenda plenty of times.
Since I've been here.
You haven't been here very long.
I can't remember how far back it was, but you took a personal attack on me because something showed up on the agenda at the last minute, and you said you can't do that. That's been several months ago when we came back and reviewed our policy.
Yeah, because you were trying to force an item without a vote. You were outside of
I don't
the
think so.
board's rules.
I don't think so.
But now you're telling me that when we come in here to meet as a board, that if there's been an insurrection out in the streets this afternoon, that it can't be considered by this board at all.
I don't think either one of your topics is an emergency item.
That's your
It can
opinion.
be. It can be with a 5-2 vote of the board.
Okay.
There's no definition of what an emergency
All
item
right.
is.
We've got a motion and a second. All those in favor of the motion to add those two items to the agenda, raise your right hand. Those opposed? Okay. We got to go back. Did we get a motion? Did we get a second to approve the agenda?
Motion to approve the agenda.
Is there a second? Second? Okay. All those in favor of approving the agenda, raise your right hand. Those opposed? 5-2. All right, we're down to item number F, item for presentation. Tammy Pearson with Child Support Awareness Month proclamation.
My name is Tammy Pearson. I'm with Young Williams. I oversee 15 counties here in North Carolina for child support. Beaufort County is one of our counties that we oversee. In Beaufort County Child Support Office, we provide services to locate parents, establish parentage, establish child support and medical support orders, collect and distribute child support, modify orders when circumstances have changed, and enforce orders that are not being paid. The Beaufort County Child Support Program encourages responsible parenting, family self-sufficiency, and child well-being. In 1995, on the 20th anniversary of the Child Support Enforcement Program, President Bill Clinton established August as Child Support Awareness Month in the United States. I'd like to present the proclamation for August 2021. Whereas Beaufort County is recognizing August as Child Support Awareness Month and reaffirms its commitment to strengthening Beaufort County's families by providing child support services to improve the economic stability and well-being of children. And whereas in state fiscal year 2021, more than $4.5 million in child support was collected from parents of Beaufort County's children. There are nearly 2,500 child support orders in place working to ensure that more than 2,800 children receive financial support from their parents. And whereas Child Support Awareness Month salutes the diligent working parents who spend time with their child and who make regular child support payments to safeguard their children's future. And whereas strengthening individuals and families promotes the safety and well-being of children, provides stability, improves the lives of children, and provides opportunities for families to be able to enhance their child's future. And whereas children who do not receive adequate financial and emotional support from their parents may experience greater difficulty in becoming healthy, happy, and productive citizens. And whereas many concerned and dedicated judges, district attorneys, clerks of court, sheriff's personnel, and child support professionals work to establish and enforce child support orders for Beaufort County children, one of our county's most vital resources. Now, therefore, we, the Beaufort County Board of Commissioners, do hereby proclaim August 2021 as Child Support Awareness Month in Beaufort County and commend its observance to all citizens.
Thank you.
Thank you.
I will entertain a motion to approve the proclamation. Got a motion to approve?
Mr. Chairman, I'd like to make a comment before we vote.
Yes, sir.
Positive comment. It's an advertisement for those of you who need this kind of a service for children to get payment. Please go to Title IV, the county office, before you consult an attorney. And the reason is they'll provide you the same services better than an attorney will at no cost to you. So please keep this in mind. Going to an attorney to sue for child support services is the expensive way to do it. This is a free service. It's paid for by the county, and these people are experts at what they do. They do a very good job at doing what they do. So please consult them before you start paying a lot of money to an attorney to obtain child support services.
I'll second.
Okay, we have a motion and a second. All those in favor of the motion, raise your right hand. Thank you. We're down to item number 6, our legislative representatives, and I do not see either one of those in the room. So we'll go to items for consent. Is there any item that we need to move for further discussion? If not, I'll entertain a motion to approve the items for consent.
Motion to approve the items for consent.
Do I have a second?
Second.
I have a second. Any discussion? Well, all those in favor, raise your right hand. Those opposed? 5-2. All right, we're down for items for discussion. Our health department, COVID-19 update. Jim?
Thank you, Commissioners. Hope you're having a good evening. Get started here, just a second. Going to give you an update now on COVID-19, and I've been thinking about this a lot because it's a message of good news and bad news. It's a lot of messages about what's in between concern and relief. So you'll see there's a balance in what I try to say about the numbers and where we're moving with COVID. So showing the state numbers, you can see that the state has had a large number of increases over the last month or so. If you look at that tail of the epi curve up here, the trend is definitely going up, and I'm sure that by now everybody's heard that in the news and aware of that increase. At this point, the state is 7 times higher than they were in June. And in Beaufort County, using the same kind of numbers, the 7-day average, you can see that we also have that increase that is towards the end of the epi curve here. This is the same graph, but I've only gone from the period of March 1st to today's date to show that we're at this point higher than we have been since the end of our big hump that we had, which ended in the May time frame. We've gone from about 2 per day to right now we're about 8 per day as an average. It's about 4 times the increase. So that, bearing that in mind, we are at 4,844 cases that we know of since the beginning of the epidemic, and about 5% of those have been hospitalized, 2% have passed on. Currently, we have 78 active cases that I know of in the county, and I have 3 that are hospitalized, and 1 person is on a ventilator. I also have, down at the bottom, you can see I have 6 people that have shown up positive after receiving the vaccination and completed 2 weeks past their vaccine series. So how do we look compared to the other counties around us? In this graph here, you can see that we're doing okay compared to some of the other counties around us. This is an average over the last 30 days, or the number of cases per 1,000 over the last 30 days. And last time I was here, the reason I picked 30 days was I mentioned that Bladen County had a very high number, and that was the one where everybody's looking at with the Delta variant. And so you can see that around the Bladen County there, the higher numbers. And then I took the last 2 weeks for this graph, which is from a different source, but it shows the number per 100,000 and over the last 2 weeks. So you can see that where it was in Bladen County a month ago has gotten out to quite a bit of the North Carolina region. There are some counties down there still in the Bladen region that are up to 700, 800 per 100,000 is their rate. We are at 180 per 100,000. And at this point, they're almost all going to be Delta variant that we're seeing. So this is the Vidant chart, which I showed you last month. We had very few Delta variant in the Vidant area. You can now see that the majority of the cases that we're seeing are Delta variants. So I just look at June and July just to see what age groups were getting infected with the COVID. So we had 163 cases in that time period I looked at, and you can see that the great majority of them are below 49 years of age. I tried to figure out why 18 to 24 is so much lower, and I just assume they're the ones that don't come in to get tested because of that age group, you know. Kids, when they get sick, are going in to be tested, and then, of course, the 25 to 49s. Did I say that right? 18 to 24 are not coming in. So the good news is that the 65 and older is only making up about 10% of the positives, and that would be the population I would worry the most about. As far as some other updates before I get into some of the other details is the mask changes that the governor put out last week with mask. See, let me find that sheet. Basically, what he had put out was that for private businesses, organizations, schools that face coverings for fully vaccinated workers and guests indoors when others are present should be used. So that's especially important when you're talking about a real large number of cases occurring around you or something like that. And then leaders at the public schools and non-schools, they're asking that they be masked as well at the schools. So the mask is, I almost didn't want to bring this slide on here because that's the political conversation that goes on. So I decided if I didn't put it on here, maybe nobody had asked me questions about masks. But I was talking about things in between, and mask is one of those things that I think about because, does mask 100% protect you? The answer is no. And people latch on to that particular answer. Is not 100% protection. But the other side of that is, does the mask reduce your risk of catching COVID? And the answer is yes. And so other people latch on to that. And that's the truth that we live in right now, is that people feel one way or the other. So, in public health, we make recommendations all the time. So if you ask me how to prevent skin cancer, I tell you wear sunscreen, wear a hat, clothing, get checked yearly, when you get older. So those are all recommendations to reduce your risk. And that's the way these mask mandates are, these mask recommendations are, is just to try to let you know this can reduce your risk of catching COVID, just like the vaccine can reduce your risk. So I just wanted to make sure that I brought up the governor's changes in the mask during this presentation. And moving on to testing. This is the first week in a while that we've had over 300 people get tested in Beaufort County. So a lot of people are now being tested. And our positivity rate has gone up from like 2.5, I think was our low, to we're at 8.1 last week for positivity rate. I generally start to worry about that when I see it 2 or 3 weeks in a row, and this is the second week in a row it's been above 5. I really get concerned when it gets around 10%. That being said, remind everybody that we still do testing through the drive-through at the health department from 8:15 in the morning until 11:30 in the afternoon, or I guess before lunch, but till 11:30. And of course, there's no charge. If you have the inability to get to the health department because of transportation reasons, BATS is available to call, and they'll bring you there for that testing. So showing the vaccinations, this is the Beaufort County residents graph showing the dark red is the first doses, and the orange would be second doses in Johnson & Johnson, so they've completed the series. So you can see over the last 2 weeks that we've really jumped up in the number of people that we've vaccinated. I attribute that to 2 things, probably opening up to 12 to 17-year-olds, and because people that were kind of putting off getting the vaccine saw the Delta news, and they're now trying to get caught up with that. I could also tell you that we're full, our appointments for the first time, 3 months, all our appointments are filled for this week. So we're going to be up in the number of appointments available next week to try to accommodate the demand in our community.
So vaccines are available to everyone who's over 12 years of age?
Correct.
Okay.
And not just through the health department. There are also your providers have the vaccine. Most of your pharmacies have the vaccine. Agape has the vaccine. And like Biden has the vaccine. They're also available in Greenville and other places. So at this point, we have done over 21,000 residents have been vaccinated at least partially. So that's 45.9 or 46% of our population. I'm trying to get that to the 50% or more. The 65 and older, 82.3% are fully vaccinated at this point. And then the 12 to 17-year-old, we have 10% are fully vaccinated, 15.4% have received at least their first vaccine. We did a survey early on in the summer with the schools and asked how many parents wanted it, and the number was about 30% wanted their children vaccinated. So I expect we'll be able to get to 30% sometime before September. But we did extend our hours which we did, that's for testing. I'll show you the vaccine hours, but I did extend the hours so that parents can bring their children after school to get vaccinated once school starts open. So this is how we compare with vaccinations with the surrounding counties. The average in North Carolina is 49%. Like I said earlier, we're at 46% of adults vaccinated, or the population vaccinated, I'm sorry. So, the question is the vaccine working? And so I put together some thoughts that I was having about that earlier today. We think about prior to what it looked like back in January and February around us, and then the vaccine came out and just those numbers started going down drastically. That's happened in every state and every country where the vaccine gets available. You've seen a drastic drop off in numbers. So that is one piece of evidence that the vaccine works. I also looked at 2 studies where 3,000 healthcare workers in the United States were followed up after vaccinations, and they showed that 90% reduction in the infections of those people. And then there's a big study in Israel where 600,000 people that were vaccinated were compared to 600,000 unvaccinated people, and their results found that it was 92% effective against infections, 94% effective against symptoms, 87% against hospitalizations, 92% against severe infections, and 84% effective against deaths. So these are the kind of numbers that you like to see when you have a public health intervention that's going on. And you love to see how effective it's working, and I use that to encourage people. Looking at the state numbers, that top one, and I used gender because it's only 2 variables, so it's easier to kind of follow the graph, but looked at the same graph for gender, and you can see that big push at the end, the last couple of months, the last month or so, that real big increase in numbers. But the bottom one shows you the deaths in North Carolina at the same time period. And you'll notice that that's really quite straight. And so what that is telling us is that even though the cases are going up, the severity of those cases for the most part are staying down. In part, that's because quite a bit of that has to do with the vaccinations and treatment of people that have COVID. So that's kind of good news, bad news I was talking about. Bad news is it's going up. The good news is that the severity seems to be staying down for right now. I say that also understanding that deaths typically follow behind case numbers by 2 to 3 weeks, because those people may hang on in the hospital system for a while before they get to that point. So I hope to have the same kind of information used for you next month. And then the other thing is the last 2 months, 4% of our cases are positive, are unvaccinated people. So out of all the people in Beaufort County that's tested positive, only 4%, 6 of them have been vaccinated at some time. And if you think back to what the effectiveness of the vaccine was, they said it was 95 or 96% effective. So a lot of times that means if it wasn't effective in you, there's a chance that you can also contract it, later on. And the Delta variant does seem to cause people to have been vaccinated to not have an immune response to it quickly. And so it's kind of slow build up. So a lot of times you'll see some of those people have the COVID, but they're usually very mild cases. Like I said, it's very effective against the severe type of COVID infections. I did mention that the health department is changing our time. We did it for 2 hours, now we're going to do it for 4 hours on Wednesdays and Thursdays. All the vaccines are available as of right now. Johnson & Johnson, it just got its shelf life just got extended to November timeframe. So we'll still be able to offer J&J while we have the supply. 12 years and older can get it, but we do require the parental consent for anybody that's under 17 years of age. And all you need to do is call that number, 940-6150. you can get an appointment with the health department. If we don't have one, we can also help you make an appointment with Agape or with Vidant or any of the other places. We have people that are trained to just try to get you vaccinated. And again, BATS can deliver you there for free. A couple of efforts that we do have going out. Maybe y'all have heard of Eating with the Experts. That's something we're going to do every Wednesday through August and in the first week of September. So this Wednesday will be our first one. It's for 1 hour from 11:30 to 12:30. We're going to talk to whoever shows up at the town hall meeting or whatever, talk to them about their concerns with COVID. And anything has to do with COVID, we'll try to have. We're going to have a pharmacist there. We'll have a doctor there. I think Commissioner Langley's going to be there. And I'll be there. And I think one other person's going to be there to try to just answer any kind of questions that are there, should people have questions. So that's at Snowden Elementary on the 4th, Chocowinity Middle School on the 11th, Wilkinson Center in Bellhaven on the 18th, St. John's Church of Christ on the 25th, and then September 1st at the Temple of Jesus Christ Family Life Center. So if you really have questions you want to come talk to us about, if you didn't call us and talk about it, we can answer to you face-to-face. We will also provide vaccines at those events. So the last thing I was thinking of was that, I was very hopeful that this pandemic was subsiding. We're down to 2 cases, and now we're up to 8 cases. And I believe that we will get a little bit higher before it gets better. I guess it's frustrating to me about how easy it is to really control this simply by getting the vaccine. I know there are reasons that we don't see polio or measles in our country anymore, and that's because of the vaccines. Those vaccines helped us to stop those diseases, and they can help with COVID as well. This vaccine is not experimental. I hear that, but it's not. The experiment was done before it became an emergency use authorization. When that became that, it was no longer experimental. It went through a lot of rigorous tests to even be classified as an EUA. And now we've been seeing people getting this vaccine, millions of people getting the vaccine since the December time frame. The vaccine does not alter DNA. It stimulates replication of the protein spike, which in turn activates your immune system. The side effects are not any higher than other medications that we use. And I say that, and I don't know if I should be giving my own personal medical history out to everybody, but 8 months ago I started cholesterol medicine because my cholesterol was high. I'm glad to know that today I took my test and it all went down. I was at 220, down to 147. My balance is good. So that's all meant to help prevent me from having a stroke or a heart attack later on in my life. Every medicine that we are given for prevention like that has side effects. Every one of them, Chronic use of Tylenol has side effects. So I'm only saying that I weighed the risk of side effect from cholesterol medicine to the risk of having heart disease or, stroke or something like that. And I've decided that I do want that intervention. It's the same thing with this vaccine. It's a matter of weighing whether you'd rather have the COVID or spread the COVID to other people, or would you rather have the vaccine and prevent it from happening. That's what public health does, is we try to tell you that risk and help you make that decision. But the vaccine does work. I showed y'all some of those numbers. And the fact that we've only had 4% of our cases in Beaufort County, that's here, showing that it works. If it didn't work, I would expect about 45% of those people that contracted COVID over the last 2 months would have been vaccinated. It was only 4%. I know it's frustrating to the medical community, because every time they see somebody that gets put into the ICU, or every time they see somebody in the emergency department, they think of how easy it could have been to prevent that. Maybe not prevent 100% of them, but prevent most of them. So it's not, this is not just a job to me. I care about the people of this county. And most of y'all that know that about me. I got the shot to show my confidence in the shot, to show you my confidence in the shot. My children, I got them vaccinated because I take the serious the disease is a serious threat to them. I report the data for the county to try to show you how effective the data or the vaccine is. But so I can only hope that these actions can convince the rest of you out there to please go out and get the vaccine. So, any questions?
Question. Of the new cases of the COVID, do you know about what percentage of those people have not been vaccinated?
96%.
Say, that's the 4%. I heard the 4%. I just wanted people to understand that 96% of the new cases have not been received the vaccine.
I've been hearing some talk about possible booster from some sources.
Right.
Are you hearing anything about the booster for people that have already been vaccinated, and at what point in time may that become a reality?
Yes, I do hear about the booster, but the conversation is not definite right now. When you get vaccinated against hepatitis B, it used to take 3 shots, So it used to take 3 to really take that last kick over to good lifetime immunity or long-time immunity. So maybe the shot will be like that. But it could also be like tetanus shot, which you only need every 5 or 10 years. I don't think you're going to see people need the vaccine every year. I don't think you're going to get to that point. So yeah, there's conversations about it, but in order to really make that decision, you're going to have to see what the immunologists are seeing, the vaccinator people, as they follow the course of whoever it is that they're following. They probably have 10,000 people. They're going to follow their blood level every month for however long to see when it peaks and then how long it takes to wane down to a low level. So the answer to your question is yes, I'm hearing conversation about booster. I don't have a clue what that booster schedule is going to look like. But I do have confidence it's not going to be something you do every year. But as soon as I say that, it may change. But, okay.
That information that you might be receiving or are receiving, is that information coming from a government agency, and which government agency is it?
Well, most of the conversation I'm hearing is coming from the state. Zach Moore, Dr. Zach Moore, who's the state epidemiologist. So he's, fortunately, I don't have to go through all the research because he's going through a lot of it for me. But I've also done some article reading and stuff like that. So government source and some academic sources.
Feel more comfortable with the state source than, say, the CDC at this point?
Well, yeah, I mean, I trust the CDC too. I'm not against the CDC's recommendations or anything like that. I think that, the CDC is made up of thousands of epidemiologists and medical folks, so I do trust the CDC.
I trust it too, except for the political wing.
Randy?
Mr. Matheson, what's the typical symptoms of a light case of COVID?
You may feel like hay fever or tickle of the throat. That's pretty much a light case. And of course, some people have good constitutions, Other people with weak constitution may want to stay in bed all day.
Any other comments? Just a family comment. My son, who is 45 years old, he's in the Air Force, stationed at a NATO base with a lot of international pilots coming in. He had the vaccine, and he's had the COVID 2 weeks ago, and he compared that to a sinus infection and was well in 4 days, but was quarantined for 10.
You can still spread it, so yeah, until we get a level of herd immunity, you're still worried about spreading it to people that have not been vaccinated. Or even that 4% that didn't take, if there was to be enough of those exposed, there could be 1 or 2 bad results.
Thank you very much, Jim.
Yes, sir.
Okay, we're down to item number J, storm debris removal and monitoring contract. And you're not Chris, are you?
I'm going to speak for Chris tonight. He's
Okay,
preparing
Cardi.
some other county business for us tonight. Thank you, Chairman and Commissioners. Before you and in your agenda book, we have a new state contract for storm debris that's been put out. We currently are under a storm debris contract with SDR. We're in the third year of that, coming to the end of it. And in our current contract, which ends in October, we are up to either renew that contract for another year or to seek a new contract. We were in the process of renewing that contract because we're happy with the work SDR is doing. The state has rolled out a new contract for both debris management and debris monitoring. So of that, we are before you tonight to request that we be able to go with the state contract. What you have in front of you, two different bids or proposals that were sent out for the state contracts. They received bids back, and they have essentially made a list of primary, secondary, and tertiary companies to do both the debris removal and the monitoring. In the past, we've not had monitoring in a contract. We've had to hire part-time employees that would look after that. So what this does for us is we don't have to enter into a contract today. The state has the contracts in place. When we have a storm, we send in a one-page request to proceed, and we then go in contract with whoever the primary, the secondary, or the tertiary in that order contract to do these services. They have 10 days to end up showing that they have 24 hours to show that they will respond to our county, 10 days to get funds in place, and then 180 days to have the complete project done. So it assists us. I'll give you an example with SDR a couple of years ago. We were in contract with them. We had a hurricane come in place. SDR told us the government has changed some wording of contracts to make it FEMA compliant. We had to change that, so we had to drop the contract. Both sides agreed to drop the contract. We had to go out for bids again, all in the time that our hurricane was upon us or just after that, and then have the contract updated. The state is going to keep those contracts updated to the correct verbiage for any changes that could happen from the federal government. So that's the big benefit we see of this contract. Secondly, it gives us debris monitoring, which we did not have before. So I respectfully request that you approve us not continuing our contract with SDR, to let it expire as normal, which would be October, and to be able to use the state contracts that are available if we need those when they come.
Motion to approve.
Have a motion to approve. Is there a second?
Second.
All right, we have a second. Questions?
I got a question.
I've got questions too.
All right.
The only thing I heard that didn't sound too good in this contract was you got 180 days to clean up the debris.
Right.
And I remember that last time we had a hurricane, some of that stuff was eyesore, eye sickening for a long, long time. Is there any way we can modify or ask them to do something with that 180 days?
So the 180 days is part of the state contract.
I understand that.
So if we went with this process, we would not. But the 180 days, I just want to be clear, is that it will be completely cleaned up within 180 days.
Well, it could be completely cleaned up in 179 days.
Right.
And like the last time it stayed, some of these communities, there was debris stayed alongside the road for a long, long time. And I don't know what the reason was, but if that's the best we can do, that's the best we can do. But I was just wondering, was there anything that we could kind of rush it along?
In comparison to our last storm, that we did have things that were left out, our last major storm, we were not far off of the 180 days having it cleaned up. And in comparison, that's what we're looking at. The storm doesn't just affect Beaufort County. If it does, we can have it cleaned up in a week or 2 weeks. But it's when it affects several counties across very many states that those companies get spread out. So that is a complication. I think that's what the 180 days are in for. So I do not believe we have the option of changing that. That is under the state's voluntary program, that if we go with their contract, it is as it is written.
You know, I have some concerns about this. Right now, if we keep what we've got one company that we're looking at, that we're dealing with. It's us and them. We've got control of it. Now, knowing how the State Department of Transportation works is a great example. and knowing how government works, and knowing how politics work, and knowing how I have personally seen the Mitchell County line, because it was Republican on one side and Democrat on the other side, when you hit the line, there was 4 inches of ice on the Republican side. Now, we're putting ourselves into a political pot, which we have no control over when we sign this contract. Because what you're going to be doing is you're going to be lobbying, trying to get your county cleaned up. The rest of these counties are lobbying, trying to get their stuff cleaned up. And I've been around politics long enough to know that there's plenty of favoritism. I can't support this. We need to keep Beaufort County contract with a provider who's going to do this, because we have control of that provider. If we enter into this, it's going to be a lot less work for the county staff. They're not going to have to do anything, pick up a phone call. But you're going to be begging for service, and you're not going to be happy with this, because you're going to have a contractor who's going, what way this thing's going to work is he's going to run over to one county and he's going to work a day or two to keep them happy. Then he's going to run over to another county and he's going to work a day or two to keep them happy, and you're not going to be happy with this. We need to keep what we have, because what we have is working. I'm not willing to put myself into a political pool with every county in the state, knowing how politics work in North Carolina.
If I could just add one thing
Yes.
to what the commissioner said, there's really no less work for the county staff in this. We would still be completely responsible for overseeing that project is taking place, doing the reimbursements just like we do before. The only thing we wouldn't be doing is seeking the contract itself, because it would be provided. Just want to make that
But we would be writing the check for all of this. Nobody's going to pay for anything for us.
We would be doing all of that and seeking our own reimbursement for it.
Yeah, so that all we're doing is losing control of cleanup in the county if we get in the pool with the state contract. And I'm not for that. That's not going to serve the people of Beaufort County.
Did I understand that there's 3 different companies that we can choose from? Did I miss?
So the way it works, there's 3 classes, a primary, a secondary, and a tertiary. The way the contract is written is you must go with the primary unless the primary cannot come. If they've already committed somewhere else and can't come, then you have to go with the secondary and the tertiary in that order.
Did you have it, John?
2 questions. One is, in our long history of having debris cleanup, what is the average amount of time? Is it 90 days?
I don't know that I could tell. I can't tell you tonight an average date, because it is storm specific, and it is dependent on how big the storm is, how many other counties or states have been affected.
Okay. Second question is SDR in that pool?
Yes, in fact, they got the primary. It's the same company for us. SDR is the primary one for all of the debris removal.
So if we chose to do our own contract, we'd still be competing with the state then?
Not really, because the state would be a pool of, say, eastern North Carolina got hit with a hurricane. There's about 30 counties in that pool. So you got a state official somewhere sitting saying where he's going to send who and what first. You don't have control of it. Whereas if we have a contract with SDR, we're saying you're coming to us first. Your state contract is secondary. As far as we're concerned, we've got control of it. When you get into this pool, you're in a political swim. And that's what it's going to be, is a political swim.
What does the current contract give the time frame for SDR?
I think SDR has to put boots on the ground in the county. That's not necessarily cleaning up, but their staff, a management staff, has to be here within 10 days, a 10-day commitment. Does that sound right to you?
So is there a time frame for total cleanup?
They have to.
In the current contract?
Yes, what it pretty, let me get here.
He's talking about our existing contract.
Sir?
He's talking about our existing contract.
Say the question again. I was thinking you were asking about it.
Okay, you said there's 180 days in the state contract.
That is correct.
What is that in the current contract?
There's not a maximum day in our current contract, I don't believe, and I'd have to go back and look at that.
So the only way to control it would be you put in something that had a shorter time frame than 180 days. Otherwise, they're going to go to the state. The state's going to tell them where to go.
The state's going to tell them where to go anyway. Even if you put a shorter time in there, the state's going to look at you and say, so-and-so, we decided such and such.
Yeah.
That's going to be it. A direct contract between Beaufort County and the provider is the only safety that's in this thing.
It would have to be somebody besides the 3 contractors that are in the state thing then.
No, it could be that one from South Carolina that's doing that. He just has to come here first.
He's not going to come here first.
No,
He's serious about this.
He has a contract. And he will fulfill his contract. He has always fulfilled his contract. You can't say that he's going to violate his contract.
Well, you're not going to be able to, he's not going to accept the contract, says he's got to come here before he does anybody else.
There's other providers out there.
Well, that's what I
He's
said.
not the only one in the world.
If I could just say about SDR themselves, they're not just an Eastern provider, they're a national provider. And there's 9 different regions that this is broken up into the state. They won every one of those regions, where that was not the case on the monitoring. It took several companies to get that. So they're a very reputable company, and either way, we believe SDR is going to be the ones that come into county.
Mr. Chairman, just real quick also, this gives us a secondary and a tertiary contractor to pick up if we have an issue. Currently, under our existing contract, if SDR can't get here, if they're tied up with something else, they'll get here when they get here. This at least allows us the opportunity to move to a secondary contractor and then a tertiary contractor. The second piece of this is the contract was written by the folks at Department of Public Safety in consultation with FEMA, so we're essentially guaranteed we'll get reimbursed for that based on that. We had, like Carney said, we had to rewrite our agreement. Those changes are concerning to us. We want to make sure that that agreement is right. We're able to push that back on the state to make sure that it is right. SDR has been a good company for us. We've got some strong contacts with them, and I believe they'll do us a good job. And I think this is an opportunity for us to put a contract in place that provides us some additional backup.
The state's going to be making those decisions. Some bureaucrat that we don't even know somewhere is going to be making those decisions. With the system we have now, we're making the decisions. We need to keep it that way.
Not going to happen on a state contract.
Benefit of the people. It is going to happen with a state contract. Some bureaucrat somewhere is going to be making your decision. That's the way it works.
Any other commissioner? Okay. Just for the public's information, if I understand one of the sheets, I think it's in there twice, where they forecast the amount of debris for Beaufort County, it's 795,000 cubic yards. That's a big number. And I guess if you divided that by maybe 20, I don't know what, that they've got dual trailers that they use to haul the debris off.
Usually 15 to 20 is what they're hauling at a time, depending on how the load moves.
Right. Okay.
Mr. Chairman, and with that, sometimes they're bringing their equipment, but you will not, more than likely, you will not see those national contractors lugging their equipment in here. They will be working with local contractors. They'll be hiring local folks and managing those folks. They just can't afford to move their equipment from here to there to here to there. That's what happened last time with SDR. They entered contracts with local providers, local haulers, and they managed those, and they made sure they were within our specs.
And I'm assuming if they're nationwide, if there's a big event that happens in eastern North Carolina, they're going to bring them in from other states to be able to do that. Okay, we've got a motion and a second. All those in favor of the contract with the state, raise your right hand. Those opposed, 5-2. Thank you, Carney. Item number K, economic development. Marty is going to talk about the for sale sign at the Chakawindy Industrial Park.
Doesn't sound so important. Yes, in the last tropical storm, some of the debris, I guess, from Elsa was the for sale sign at Beaufort County Industrial Park at Chakawinity. We got a price for that from Hudson Signs to replace it, $970, $850 for the sign and $120 for installation. And so basically I come before you tonight to ask you to take some funds from the general fund to purchase that sign and have it installed.
Okay, entertain a motion.
So move.
Got a motion? Is there a second?
Second.
Motion and a second.
No question.
Mr. Questions? Yes, sir.
Go ahead, State. Yeah, don't y'all have petty cash for $950?
No, I don't.
You spend a lot of money
It's
in your
not-
department.
It is not in my budget, no.
Wow.
It's not, I do not have funds to use on the industrial parks, just for the skills center.
Well, I've been around for a while, and bringing in a peanut like this for approval is a waste of our time, and the funds are in the budget. It's the old hat trick. Let's see you find it. They're in there. So this is just a sham to increase your budget, and I'm not voting for it because of that.
The money is not in the budget. I am very specific with everything that I put in the budget. When you ask me to put a budget together every year, this was an item that maybe I overlooked and should have been in there, but it definitely isn't in there, and the money I request from you is what I need for the year.
Don't you have budget variances? Are you exactly 100% to the exact penny on your budget?
That is what I try to do. At the end of the year, I have variances, yes, but it's under. Every year, I try to be under my budget. I don't try to spend excess money, but I don't know that till the end of the year.
Martin, that's what we're paying you for, to manage.
I know, I am managing.
Okay, and you're doing a good job.
Thank you.
All those in favor of the for sale sign, raise your right hand.
Thank you.
Those opposed? Wow.
What?
And it was a waste of time.
You guys get taken
Waste
all
of
the time.
time. Yeah. Okay, we're down to the financial report. Anita?
Yes, thank you, Mr. Chairman. You have two handouts at your desk there. One of them is the sales tax distribution. The second one is a summary of revenue and expenditures. We can talk about the sales tax first. We did receive word today on the May sales that we'll receive later this month. You'll see that in the very last column at the top, go down to May. There are $1,001,164. So this is the third consecutive month and the fourth time in fiscal year 2021 that we had a sales tax distribution in excess of $1 million. And then if you look at the graph historically, we would even expect our last distribution for last fiscal year to be even a little higher than that. Typically it is, if we look at historics. Did want to give you a number on where I do believe we'll end up for last year on sales tax. So if you'll go just below that total for the fiscal year, the last column, the annualized number is about 11.5 million. I think that'll be about our estimated collections for sales tax for the prior year. And then also wanted to show you, because there was a little bit of question at the last meeting about budgeting revenues, did want to show you some trends and historics on the growth for our sales tax year over year for the last several years. And you can see there, it's anywhere between 400,000, 500,000, 600,000 typically a year is our growth, or about 6% on average. And then you can see during COVID, instead of it going down drastically like we budgeted and anticipated, it actually doubled. We had a 12.3% growth amount from last year in our sales tax. So any questions on sales tax before we move on?
Yeah.
Okay. Next, just a quick glance at the summary of revenues and expenditures on the next two sheets there. This, of course, is for July. We're only 1 month into the fiscal year, so not a lot to report there. You can see the first revenue there is ad valorem tax collections. Go over to the fourth column, your actual collections through July, only $48,000, but that would be for the previous year's levies, where, the delinquents are still coming in and paying. The bills for the 2021 levy have not gone out yet. I'm hearing they're supposed to go out in the next couple of weeks, hopefully. Lloyd shaking his head yes. So that'll be good. We'll start seeing our tax revenue roll in. Even though the bills go out in August, people still usually typically don't pay until November, December, and that first week of January before the penalties are applied on January the 6th. Expense side there, no real variances to report for you there. You can go down to about the fifth one from the bottom on the first page. and you'll see that negative available budget for the health general budget. And that's just really an accounting thing where the payroll all gets expensed to one department, and we have to do an entry to fix that and allocate it to the other divisions. So that's really not a real number yet. We have to do a little work with that. And then on the back page, I've circled a couple of numbers at the bottom. Just want to point out, even though revenues show as a minus, they're definitely not in the negative. That just indicates it's a credit. It's an accounting thing. So the July revenues are $1.724 million. The July expenses are $5.8 million. The difference is the $4,082,000 just above that. So what this demonstrates to you is, you know how we talk about the necessity for a general fund balance, and one of the reasons we want to have a healthy fund balance is for cash flow, and this really demonstrates that well, I think. We had expenses of $5.8 million. We only took in revenue of $1.7 million in July, so we relied on our fund balance of $4 million, over $4 million in July, to float us through the month until we can start collecting that tax revenue in November and December. So any questions there?
Will you mind tracking that number? This is for the month of July, right? So
Yes,
this is
sir.
the first month?
The cash flow, the fund balance usage?
Yeah, that 4 million, if you can track it each month, because that came up during the budget workshop.
Right, will do.
Okay.
Yes, sir.
Anything else?
That's all I have.
Any questions of Anita? Thank you very much. We're down to the next item. Katie, the electronic sale of surplus real and personal property.
Well, I've got one more. I'm sorry.
I'm sorry.
When you
I
asked me
apologize.
anything else, I thought you meant on the finance report.
Okay.
I'm
I
sorry.
apologize.
On page 356, I do have another item. This is basically a correction on how we budgeted the ARPA funding, and this is based on additional guidance that I actually provided in your book that came from the Local Government Commission on page 360. So they highly recommend that we put these revenues in a special revenue fund, and back in June I placed them in the general fund. So this action just reverses it out of the general fund and puts it in that special revenue fund as directed by the Local Government Commission.
Need a motion?
Motion to approve.
Okay, I got a motion to approve. A second?
Second.
Okay, all those in favor, raise your right hand. Thank you. Now, Katie, we're down to the electronic sale of surplus real and personal property.
Yes, sir. Staff is asking for approval to be allowed to sell real and personal property electronically, mostly through govdeals.com. I've provided some information on how they do those sales. This does not stop us from being able to do it the old version, but it does give us a much wider audience on property sales and surpluses and things like that. Just about every county in the state uses them in one manner or another.
Questions of Katie? Entertain a motion?
I got a couple of questions. Sure. Who is hands-on on running this, making this work?
That would be me. I actually have a representative at govdeals.com who I can talk with. They'll help me set up the ads, talk me through it, and I can also contact them if there's an issue.
So when we approve the disposal of surplus property, you would take it and put it on that?
Yes, sir. I would
Okay.
monitor that personally.
Okay, and how and where do people see property in these things?
They actually, there's a search engine on it. You can actually put in what you're looking for, but they also do marketing, especially with the bigger properties or...
Well, properties I'm not concerned about, like real estate. I'm concerned more about if we had a batch of computers to sell or cars to sell or something like that.
People go in and they look for, like, the way that you can look on the search engine is you can put in specifically what you're looking for, or you can look at a certain area. I know cars get a lot of traffic.
Yeah, well, that's the search, though. Let's say that I found a car that I'm interested in. Who do they contact, and how do they get to inspect the car before they make an offer?
They can actually Holly Smith, who is our purchasing officer, actually does the vehicles and those kinds of things, and they will and can contact her. Our emails are on there.
And she will get them in a place that they can see?
Yes, sir.
Oh, okay.
We do sell everything as is, though, just to
Right.
clarify,
That's
because
right.
we don't make any repairs or any guarantees at all.
Okay. Entertain a motion.
So moved.
Is there a second?
Second.
All right, any further discussion? All those in favor, raise your right hand. Thank you. All right, we're running ahead of schedule, and we'll just keep right on going. Item number N, item for decision, Brian, county's website.
Thank you, Mr. Chairman, members of the board. This is the item that you had on your agenda last meeting. There were some questions that were asked of the county attorney. It's my understanding that all the information that was requested has been provided. I know I provided information to the board, and the county attorney provided information to the board. So we have this back on the agenda for your consideration, and we would make the same recommendation that you allow us to move forward. Thank you.
I have a couple of questions before we get into this.
Okay.
Well, one of them has to do with why do we need to change the website? What are the problems with the website?
The reason we put this out to bid because the board voted 6-0 at October 5th of 2020 to do this.
But the board didn't specify any reasons for doing this.
We were directed by the board to put it out for bid, so we put it out for bid.
Yeah, well, what I'm getting at, is there really a need to do this?
The board thought there was a need to do that, and we as staff would take that under, we would do what you said.
Is anybody on the board can tell me what the defects?
For one thing, the contract was expiring.
Well, that's not a defect.
No.
Yeah, but that was the reason it was on the agenda. It was coming up for expiration to put it out for bids.
But what are the problems with the website that we need to spend all this money to fix?
I don't think that was the point. There was no discussion, as I recall, about that. My recollection was that the contract was up, Stan was in favor of going out for bid, and so we just approved it going out for bid.
But again, as a commissioner with fiduciary responsibility, if it doesn't need fixing, my question to the board is, why are we fixing it?
Because you still have to go out for bid.
No, you didn't have to go out for a bid. You just renew the whole contract and keep right on going.
Mr. Chairman, I think the other matter was that according to the county attorney, it can't be continued the way it is.
Okay, let's go to that issue then. You asked the county attorney, you have produced your opinion piece as to why the Commissioner Deathridge can't continue to provide this service in writing.
Is that a question?
Well, that's a question, yeah.
Have I done that?
Yes.
Yes, I did.
Okay, and that was presented in the email. On what date? Can you identify the document?
I didn't bring my file tonight. I didn't think we were.
We asked you at the last meeting to produce this in writing.
And it was. It was in an email.
Is this the email that you sent to the commissioners?
Yes. Yes.
Is it the one that said memorandum at the top? I'm just curious. I need some color.
Did you see it? I sent you a copy.
I'm just asking a question.
We're just trying to identify the document. Can you identify the document? How would you identify the document that is your legal opinion that Commissioner Deathridge can't continue with this?
Well, there were several things that were mentioned in what I sent you. One of which was that he was receiving payment on something and had a contract on something that put him in violation of the law. And I gave...
And it's your opinion that he's in violation of the law, is that correct?
Correct. Yes. Okay.
And that's in the email that you sent out, that Commissioner Deathridge is violating the law?
County case for the Court of Appeals, yes.
And what law is that?
North Carolina law.
Which one?
Which law is?
Yeah, which general statute is he violating?
I don't know off the top of my head. It's in chapter 14,
Okay,
criminal laws.
criminal laws. But there's a general statute that says if the population of a county is less than 15, of a city, any city is less than 15,000, and gives some stipulations that Commissioner Deathridge is within. So how is he violating a criminal law?
It doesn't apply in his case, and I pointed it out in my memo to you too.
The criminal law does apply in this case.
Criminal law applies, the exception does not apply.
Okay, the exception does not apply to Commissioner Deathridge, but the criminal law does apply to Commissioner Deathridge.
Yes.
Okay, thank you.
Yes, John.
I'll come back if I need to.
The email was dated 6/17, and it went to all of us, in terms of David's opinion.
Is that the email that we're talking about? The one that's dated 6/17?
We didn't act, that's not, it couldn't be. There's no way it could be.
Mr. Chairman.
Yes.
I'm sorry, I don't have a mic.
We met in July.
Mr. Chairman, I've pulled my emails up real quick. There's an email from the county attorney to the board on July the 9th. The subject matter is bid for website -Deathridge. And it says, I'm attaching a memorandum of conflict of interest matter involving Commissioner Deathridge.
Is that the email that you assert is your opinion?
I believe it is.
I need to know for sure.
This is not even on the agenda tonight, okay? I would have brought the file. I do not keep all of this up here constantly. So I'm telling you what I did, and he just told you what it was, so that's probably
So
right.
you agree that is?
I think that's it, yeah.
You think?
I think so.
Do this every meeting.
Well, this is important.
No, it's just strictly important to you. It's important to the county, it's important to the board.
No. Y'all are taking y'all private stuff and putting it on display here. And we don't have time for it. We're gonna do the whole county's business, not just Hood and Sands.
Well, let's put it this way. This board can't give a reason why they want to dissolve the existing contract and do a new contract other than to accuse Commissioner Deathridge of being a criminal. Is that correct?
No, that is not correct.
No, it's not. Well, tell us what is correct.
To tell you what is correct is, I don't know what this board did, but Edwin Earnhardt Booth did not accuse Mr. Deathridge of being a criminal. So so you got to go back and regroup that. Have I ever accused you of being a criminal, Commissioner?
No.
Your mouthpiece did.
Well,
what's the difference?
So you did then, because he's yours too.
It's important that we do the business of the people properly.
Gentlemen, we had a discussion last time. We've had further clarification from the attorney. It's on the agenda. So.
Yes, it is on the agenda.
It's on the agenda for a vote.
Yes.
Yes.
That's.
And I'm assuming that you want us to vote to excuse you since you're part of the.
We'll get to that. We'll get
He's
to that.
not a part of it.
That's right. You're not. So you can vote on it. You can vote on it.
He's not being considered for the contract. He can vote.
That's right. I apologize. Okay.
Well, is it my time to speak?
Yes.
Okay.
You got the floor.
Since this all started with a opinion from Freda Bluestein, manager, I still haven't gotten a copy of that opinion from Freda Bluestein.
I sent you the emails that I got from her. You have not sent me the emails that you said you got from her.
I sent you that email on October 6th.
I'm sorry.
It says, the law generally prohibits, this is from Freda, a board member from having a contract with the unit of the government. As you know, there is an exception for small counties. This is her telling me. I'm not asking her. I told her this was a very political situation. It was politically charged. You're walking into a minefield. This is what she said. If the requirements of the exception still apply, no city or county larger than 15,000 and the contract above 40,000 within a 12-month period, you're probably okay. I think it would be appropriate for the board to adopt special resolution required under that statute to make sure that the board approves of the continuation of the contract under the exception. That would be the bid process. Now, I didn't get it. Did you send it to Stan at Beaufort County Now, or did you send it to my government address? Because I haven't seen it either way.
No, sir, I sent it to your government address, and I sent it to every county commissioner. You're included in that.
Can you tell me what date you sent that?
No, I can't. I only deal with Beaufort County addresses. I don't send to other addresses.
Well, my business address is my business address, and we were talking, it depends on which hat I'm wearing. If I'm being told as a county commissioner that there's a problem, that's one thing. When I'm being told as a Stan Deathridge vendor, that's a different issue altogether, and that should go to my business email.
And Commissioner Deathridge, that is the issue right there, the conflict.
Well, this has just come up 6 days after the bid was submitted, and I was 40% of the guy you really want to use.
The request
I think you guys have had long enough, and the School of Government has had long enough, giving me 3 opinions from the School of Government, and you, your staff, the attorney, these commissioners have had years to decide that I had a conflict or not. And it just happens by timing, 6 days after the bids come in, I have a conflict. Oh, but I'm 40% of the lowest bid. I think it's a political situation. This is not a governing situation. It is not a business situation. It's a political situation. Now, you commissioners, like what Langley was alluding to, he wants to do the business for all the people, which means we just do the business that is important to him. You guys can make this decision right now. You can say, Stan, for any reason whatsoever, we don't want to do business with you. You don't have to say, it's a conflict of interest. This is a tortured opinion coming from this attorney. But it came from him, and it has become the news of the day, and this gives you the out to do this. You can do it from a political standpoint. You can say, we love the guys from Manhattan, Kansas. So what if they're 3 times the money to the people of Beaufort County? We want to change. You can just say that. And then you got to live with it. So, but that's not say it's a conflict of interest. When we really haven't gotten a suitable opinion from our attorney, or the manager sending me the Freda Bluestein opinion, and I want something to go to the Attorney General and find out what he says, because the general statute is the general statute. It's written by our General Assembly. I take that to be sacrosanct in the bid process, and I expect that to be the last word, and it needs to come from the Attorney General. Now, you guys can do whatever you want tonight. We are still going to go and look and find out what is true in that respect.
That's the general statute.
I got the general statute. I've read it.
Okay, you got to read the whole thing then.
I've read the whole thing.
Okay. Then you know that it says
Okay.
there is an exception.
I will entertain a motion to approve the bid.
Motion to approve.
Got a motion to approve. Is there a second?
Second.
Okay. Now, discussion.
You need to ask for permission not to vote. If you're not going to vote, you need to.
I don't think I should vote. I've never voted on me making money or not making money. I was told by the School of Government 3 times, and you have a small county exemption stand, but do not vote. And I'm not going to vote. I don't want any perception whatsoever of a conflict of interest. So I ask for
I
permission
move
not to
that,
vote.
I second Commissioner Deathridge being removed from the vote, being excused from the vote.
Does this require a unanimous decision by the board to excuse him?
No.
Does not? Okay, just a majority.
Mr. Chairman, just from the standpoint of if you have a conflict, I think Commissioner Richardson said at the beginning of this, Commissioner Deathridge is not on this, so he doesn't have a conflict now. So he has an obligation to vote under the statute unless you excuse him for a conflict. And if you determine there's a conflict, I'm not sure how he has a conflict if he's not on this item. But that's for the board to decide.
Okay, we got a motion and a second. Call for a vote.
Wait a minute, I got a motion. Okay, and we're voting on what now?
We're voting on to recuse Commissioner
What's
Deathridge.
his conflict? He's not on, what is his?
That's for your interpretation. According to our county manager, there is no conflict.
No,
There is no conflict. So, all those in favor of recusing Commissioner Deathridge from voting, raise your right hand. You're not voting on that?
Well, I can.
Okay. Those opposed? Okay. All right. Now, we had a motion and a second to accept the bid. Yes.
I'm not voting for it. Once again, I want to see local dollars stay in Beaufort County. This isn't in the city, it's not in the county, it's not even in the state. We're going to Kansas. So I'm not voting for it. Whether Stan does it or not, I'd like to see local people participate.
I have a reason too when you get ready.
You want to go ahead and comment?
Well, I just want to say I'm not voting for it because the people that are being awarded the contract are charging 3 times what Commissioner Deathridge has volunteered to continue providing the service for. And he got this service when he was not a commissioner, when he bid and got the work. And this board has shown no reason for changing the present system. Nobody has stated a defect in the present system that Commissioner Deathridge provided. So I'm voting against.
Okay, I'm voting for it because of the fact that we put it out for bids, and it is a conflict based on the fact that we put it out for bids based on the interpretation. So, all those in all.
I guess. Thank you.
I think you've already spoken on how you feel about it.
Yeah, but I can come around. It's time coming around again. Come around.
This is your last time on this.
That's
Go
fine.
ahead.
Yeah, when I voted for it to go out on bids because it was represented to this board, it's not a conflict. The manager said he understood the small county exemption at that time. Everybody knew that. Now, if this is a play with the attorneys in with you guys on this to get me out of it and bring in this play of because we bid it out, you're finished, Stan, then I think that's a pretty sorry way to get rid of a Beaufort County citizen who's given you the best service you've ever had on a website. So if that's what you want to do, if you want to be known for that and make this a political issue, which you are doing, because this is no conflict, we're going to find out just how big a conflict it is when we go to the Attorney General's office. So, and we do have the opinion now from our attorney, or your attorney, not mine, and we'll find out what it is. And I will report. Maybe not back to you because you guys are completely unconcerned, but I will completely report on this. It is a political issue, and we'll keep it in the political realm. It's not a conflict.
Okay. All those in favor of the new website design, the bid, raise your right hand. Those opposed? Thank you. Okay, we're down to 7 o'clock, so we will take a break. Okay, we'll reconvene. We're down to Commissioner Revolvers. Preparing permission for vaccines.
Right. Over the course of the last several months, I've had anyways, multiple people inquire about this minor authorization to consent and what that possible impact could be on vaccines. So what I passed out to you is a copy of the opinion from the School of Government on minor authorized to consent. Okay. And what it references in North Carolina Statute 90-21-.5, it authorizes a physician to accept the consent of a minor for medical health services for prevention, diagnosis or treatment of venereal disease or other reportable communicable diseases, which certainly would include COVID. It further says that it expressly authorizes a physician to accept the consent of that minor, and that the North Carolina Attorney General has advised that this authority extends to nurse practitioners and physician assistants. So the question I have, and I'm trying to get a handle on, is given this, what is going to be the policy within Beaufort County, primarily Beaufort County schools, as to how they're going to be giving out, if they're going to try to use consent, minor consent, in order to give vaccines. Okay, and I don't know as we have any of that information here, but I guess I would like to ask that we request of the superintendent what their policy is going to be, or the school board. Because the potential exists. In fact, there's another one out there right now that says, in North Carolina, the state's Department of Health and Human Services has affirmed the right of minors of any age to receive COVID vaccine without parental consent if they are able to understand and make decisions about their health. That's the thing that has to be determined first. But that's in the eye of whoever the beholder is, whoever's asking the questions. And so I think it's important for us and the public to be aware of what the policy of the school board and the school district is going to be. Can we do that, Katie? Yes. Okay. Good.
Any other comment?
Well, I think when we do that, probably need a copy of that statute having to do with minor consent, because if I remember correctly, when it was passed, it was very specific in what services a physician could provide without requiring consent.
Yeah, it is. And that's what,
So you
they're lifting that.
all you want is just their policy.
Yes.
Okay. We're down to items for discussion. Commissioner Richardson.
Okay, the first one is the police report. The police committee met last month. We'll be meeting again in August. I think it's the 26th of August that we meet again, and at 6 o'clock here in this room. The public is invited. Well, let me turn this thing on. The public is invited to the police committee meeting at 6 o'clock on August 26th, Thursday evening. There's controversy about what's going on with the police committee meeting. It troubles me that we have people out that are trying to make hay by claiming that what goes on at the police committee meeting is not truthful, and they are simply uninformed, and they need to get the factual information before they start making comments on what we're doing. Otherwise, we're going to have some very public discussions about who knows what they're talking about and who is simply throwing darts to try to make a political advantage. At the committee meeting in August, we're going to decide about our trip to meet with the Beaufort County Commissioners. And of course, all of the, not Guilford, you're right, Gaston County Commissioners, you're right, thank you. County Commissioners, we have been in contact with some of those people, and we have some very positive reports so far. I would mention a couple of things that came up last meeting is sheriff's reports. We have asked for the sheriff to give us reports on contacts on a monthly basis, whatever reports he wants to give us. There were no reports that were given this month. I refer you to the Beaufort County website where you can see all of the sheriff's reports that you want to see, not sheriff's reports, but police department reports as opposed to sheriff's reports on the crime level in Gaston County. And it would be very interesting, I think, for the people in this county to see those crime reports because I think drugs are eating us alive any way that you look at it, and I think there's a lot of things going on that are simply covered up and we don't know about. And if we see those reports, the public would be able to answer questions and become much more informed. So I'm making a request of the sheriff that he provide us with those reports, whatever reports he has that he wants to provide us with. And he knows what's the easiest thing for him to do. That is all that I have to say on that particular subject, unless someone else wants to say something. The next item on is filming commissioner meetings, points of contact for filming meetings. The manager has presented us in this booklet with a list of places that the public can have access to the filming of commissioners' meetings. I hadn't seen all of those at one particular time. There are probably some gaps in the public having access, but for those who need this information, I think if you'll contact the clerk, I think she'd be glad to email it to you as to how that you can get access to what happens and what goes on at commissioners' meetings. One question that I have that I haven't looked into is streaming meetings. This meeting is streamed. Does this mean that during the month that you can go to this same site and pick up the commissioner meetings again?
Yes, sir, you can. Speaking of streaming, we've lost our stream, actually. The encoder's kicked out. Vimeo's shut off on it. But yes, you can. What it does, it takes about 10 minutes after the meeting is over. Once we close the live streaming session, it takes about 10 minutes for Vimeo to process it, and then it uploads it to the Vimeo site, and it just stays there. So you can go and get, ever since we started live streaming, you can go back and get those meetings. What we'll do tonight, like we've done before, is you're still recording, and what we'll do is we'll go out there and we'll take the one that's messed up, and we'll take ours and replace it with that. But because we've lost, right now, anybody who was watching live is not able to watch it right now because we've lost the encoder stream. So, but yes, it is available out there. They're also available on the YouTube channel. The camera's got a YouTube channel, so historically they're out there.
Okay, if people have questions about this, they can, of course, contact any commissioner or contact me, the manager's office, or whatever, and I'm sure they'll be glad to help them. Does anybody have any questions about that particular item?
Go to the item number 3.
The
ARP.
Yeah, funds, yeah. Commissioner Richardson would like the board to consider assigning a value and include the construction of a storage building using the American Recovery Act funds. One of the things that I would like for us to do tonight, we weren't really complete when we met on the ARPA funds. We voted one thing and that was it, and then the meeting was sort of over with. We need to go back and take a look at this storage building, and to do that, you have to make a motion and direct the staff to go ahead and put this on the list and start investigating. It's not an approved item, but it gets the ball rolling.
We did direct the staff to go and do the water and find out what that would take.
Yeah.
Okay? And that hasn't come back yet, so I don't know we've got an updated dollar amount on the building of $1.2 million.
Yeah, but we haven't done, in my opinion, and maybe more's been done than I know about, enough of a complete study as to what would go into the building, what services would be providing in the building, and for instance, is part of it going to be climate controlled? If not, these are things that we need to just be talking about as we roll toward getting this done. It's true you may kill the project, but it's free money and it's a free building.
Commissioner Richardson, you're right in that if we picked a general location out by the water plant, the city's water plant, where we have some property, we looked at that and we said, put us the biggest building you can put out there. I think it was 16,000 square foot building. If we were to move to other places, you could probably put a larger building. That number that we had with loading dock and some conditioned space, which we would want some conditioned space, was right at 1.196 and 1.2. We could refine that further down if there was a different location, if we wanted to put it in one of the industrial parks, maybe something like that, have a conversation with Washington about that. Our goal on pushing forward, like when we talked in the budget about the storage facility, was that the ARPA funds will allow you to do that if you're going to use that facility to receive disaster supplies and redistribute those. Thank goodness that doesn't happen every day for us, so there would be an opportunity for us to use that facility for other measures as long as we had it available for emergency use. And I think we could certainly balance that out and make sure that occurred. But I do believe there's some things that we could take off the table that we're currently doing in a facility like that. We just can't lead with that because they'll say, well, that's not what it's for. So,
I understand. Well,
yes, sir.
you know, I think that as a board, we should give a stronger authorization to the manager to proceed with these studies. I mean, I don't want to see things fall.
Right. The Public Works Director and her staff are currently working on their recommendations on water projects, whether that be loops they need to close, extensions they feel like need to be put in, SCADA system, other things like that. They are working on that. So
along the line on that, one of the requests that I have is that they bring us a list, it may be an incomplete list, at the next meeting of their proposed projects and about what they're going to cost, because we have some issues here like the people south of Aurora that were in here wanting stuff. We have some other incompleted things like, I know the Robert Whitley thing is controversial, but we need to decide about that. You can argue that he's equally entitled to the use of those funds as anybody else is. So these are issues that we need to keep pecking away at as we proceed to get resolved.
we will have you a list at the next, we'll have the board a list at the next meeting. The Public Works folks just hadn't had an opportunity to get that number on there yet. They wanted to get a number on it so that you wouldn't, so you'd have a general idea of what you could do and not get too far down on the list and not have enough money to do it. So
yeah,
we'll have that.
I don't care how incomplete the list is. I'd just like to begin seeing a list and seeing more information on the agenda with these things, because it's going to take some talking about, and we will save months of time if we go ahead and do this now. Does anybody else have anything on that?
I got a question as it relates to that building. Can you go ahead and build into it the storage for the sheriff? And where I'm getting at, Brian, is that if you admit that it's a $2 million building and 1.5 is for, the purpose that's eligible and 500 is for something that's not, can you go ahead and build that building and only fund like the 1.5?
I think you can. I think you just have to be careful about how you package it.
Okay.
And not lead with, this is going to save the county money by not storing stuff in other places.
Yeah.
Yes, that's a secondary benefit. Our primary goal is to have an area where we can, with some conditioned space, where we can store emergency supplies when they come in from FEMA to allow us to respond to a disaster, including another pandemic that may occur. But during that time frame while we're anticipating another one to occur, we can use it for other things as well.
Does the 1.9, does that include the area that was needed for the sheriff's office?
The 1.9 looked at a sheet metal building with concrete pad, grade entrance on one side, a dock, a shipping dock at the other side where you could bring in 18-wheelers and they could dock at it. And it included some work interior to be able to do some storage. If we were to do something specifically for some of the sheriff's office stuff, we'd probably have to add in some additional security measures and some conditioned space specifically for that. And we didn't get into that detail when we were talking about that.
Well, I agree with Commissioner Richardson that we need to give you whatever input if it requires a motion, or if you. It sounds like it's already in the process, and you're going to bring us back the information that maybe we need to come up with an approval.
Yes, sir. You will have on the next agenda an item that will include the Public Works Director laying out for you her recommendations based on her priorities. We'll give you a number on the building, and then you'll get to make the decision how you want to allocate those out.
Is that okay with you, Hood?
Yeah, I think so. Just the process is what I'm more concerned about than anything.
Okay. You want to go to the next one?
The next item is a library system. I know that this library is a long shot. I don't want to give up on it until we finally at the end of the rope, because the library system in Beaufort County, while we have some good libraries, they are small libraries. They are incomplete libraries, and I think we have an opportunity to have a much better library system than we have now. Whether that comes under infrastructure with all these definitions, I understand what people are telling me. I just don't want to see it die.
You want to go to the courthouse basement jail?
Yeah, I think we need to get aggressive about this, because there's opportunity here to build out the basement at the jail, save ourselves a lot of money, and to provide some better cells and service than we have now. We need more isolation cells. There's an opportunity maybe to provide some different services, like some of these attorney meeting rooms that we keep hearing about, a whole bunch of other opportunities there. And it's infrastructure, and we can use it. The argument would be that we're reducing the density in the jail, and that helps with the COVID thing. So I would like to see us go ahead with some minimal studies to see about what that would cost, and to find out from the sheriff how they would like to see it developed, so that we can all start looking at floor plans would do it.
The jail committee, you want to comment on that? We had the architect come in and kind of give us some ideas of what we could change in there.
He did. The architect that did the last upgrade for us, and actually did the one previous to that, came in and made a presentation to the jail committee and said, yes, he felt there could be some expansion in some areas. Obviously, that's going to take away from some other areas. The critical piece about that, of course, is making it the health considerations, and having more space to spread folks out is something that we see. In some of the questions that were asked of Treasury, they said very clearly, no, you can't go build a new jail, but you could take your existing jail and do some modifications to it to help out with isolation areas, more space to spread folks out, to have folks where you can isolate them, because we did have that. There was a challenge in that with the sheriff's office. They did a great job with the nursing staff that they had from the health department, testing folks and making sure they got folks quarantined and away from others. But obviously more space would always help. And if you were able to put in maybe some negative ventilation, negative pressure rooms, that would be beneficial as well.
We didn't ask this when James was here, but do we know if there's been any outbreaks of COVID, this Delta, in the jail?
I am not aware of any. That doesn't mean there hadn't been, but I'm not aware of any.
Charlie? No. Just yes or no is fine.
The protocols for COVID have been pretty consistent. I haven't heard of any positive tests within the last handful of weeks, that it seems like everything else is spiking. But just understand that we are bringing people in constantly. That could be something that, as I'm telling you that, there might be something that's popping positive right now. The only thing that I did want to mention as well is that the commissioners, get reports on the population that we have in the jail, and just note that it is getting back to pre-COVID numbers steadily and increasing. So, I mean, where before we were in the 20s and 30s, we are steadily in the 40s and 50s, and I don't see any reason why that number is not going to keep on going up, just for your consideration on your planning and conversations.
Thank you.
Thank you. You want to move to the next item?
The next item is going to be more controversial, but it concerns ban the use of public funds to teach or promote critical race theory. Now, a lot of people are going to say this is up to school board more than it is commissioners. Yes, that's true, but the money comes through us. Turn on the mic. I'll start over again. This is going to be more controversial. This is to ban the use of public funds to promote critical race theory. I know that a lot of people are going to say, leave this up to the school board, but the money comes through the commissioners, and in some counties, the commissioners have taken a position on it, and there's nothing that says we as commissioners cannot take a position on it. So my motion is public money shall not be used to teach or promote critical race theory in the Beaufort County schools. That's a motion.
Second.
And I'll make comment.
Hood. Sir, ma'am.
Yes. I agree. It's a question of funding. If it's a question of funding, commissioners do the funding. Right now, the federal government is playing games with funding. They're saying, if you don't do what we tell you to do, we're going to take your federal funding away, which I think schools would be wise if they got rid of federal funding altogether and they wouldn't have to listen to the federal government. Because federal government right now is FUBAR, 100%, top to bottom. And critical race theory is a now kind of wild thing. Most people don't know what's in it. I do. Nothing of good is in it. It teaches things that are so out of whack with the history of our nation. It's done as a political ploy to bring people under a political tent that are disconsolate and unhappy with America. What it does, it fractures Americans into different categories, different groups, and it says, you are different, you deserve more than this person, and we're going to get it for you. Keep voting for us. And we see it going on at the border. Here we are talking to Jim Madsen about the Delta variant, and we've already let 1 million people in this year across the border because it's politically expedient. Now I'm hearing that they want to give these people amnesty or start amnesty for folks, and that ain't going to happen. It's all part of the same plan. Come to us, vote for us, we'll give you Marxism, and then we'll stay in power. What people don't know is once you lose your freedoms in this nation, once you stop teaching that freedoms are fought for and gained in this nation, Marxism's not going to work. People aren't that smart anymore, so they think, oh, if I can get something for free, like I've gotten in COVID, hey, my life will be perfect. I can just live off society. So we've got a problem here, and it's all tied to those political supplicants who would do anything to this republic to stay in power. And we see it going on in Washington, D.C. right now.
Other comments?
Help me out here. I thought we were just responsible for the buildings. This seems...
No.
No? I'm the new guy on the block.
The buildings are what we have to do. The elective funding is what we do as a matter of course to be competitive with other counties.
What punishment?
It's a lot of money that we give them. I mean, it's the buildings is probably about 25-33% of the funding, and the rest of it is elective funding.
What punishment if it just happens to show up and we vote this through tonight? What is our punishment? What are we? What's the end game?
Withhold. So the budget comes up next year.
The schools get a lot more money from us than they do from the federal government. So the idea is they'll do the right thing. I think they'll do the right thing anyway. I really do. I feel that our school board's pretty smart. I think our superintendent's pretty smart, and they'll do the right thing. But we just need to give them every scrap of encouragement we can to do the right thing.
We need to support them all that we can.
Yeah.
Critical race theory teaches segregation.
Yes.
It teaches us that some of us are better than others, and it breaks us back into racial groups. A lot of progress has been made on integration in the last 30 or 40 years. Critical race theory, because it serves the communist purpose of division of the nation, teaches segregation. You are different than I am, and I'm teaching you that. No, we don't need to go through that again.
To get back to your question, Randy, I don't have any problems if we have a motion and we ask them not to teach it. But I think anytime we get into the funds, in our budget process, we approve operating money and we approve capital money, but we don't tell them you can't teach math or you can't teach sex. I mean, those kind of things. So, I mean, I don't like the idea of saying we're going to ban the funds, public funds. But I do think that we can take a stand as far as teaching, so.
Does that mean Mr. Richardson needs to rephrase his motion?
Well, we don't have a motion on the floor, do we? We do have a motion on the floor?
I'm just saying we're not going to use public funds to teach critical race theory. And
I guess my question is, how we can't track dollar for dollar what's being,
That's correct. You cannot track it.
So,
In public money, is bigger than, that's everybody's money.
that's federal, state, and local.
Well, we can only control our money, so they can only apply to what we can do. I don't know that we would hand out punishment because, I don't know that we'd hand out punishment. I mean, I answered Commissioner Walker's question directly as a question. If the inference in here is that I support taking school funds because they're teaching this, I don't. This is a policy thing. There are many other political ways to resolve this issue rather than the use of funds. So I would go to those things before I ever went to funds. I mean, it's who you elect to school board, it's public outcry. There's just a lot of tools out there to work against this, but I think we need to give the schools as much of a message as we can that this is not to be taught. So if you want to remove the use of funds from that, then we can rephrase it so that the money part comes out of it, because I don't think the money part makes any difference. The chairman is correct. You can't track a dollar as to what it's doing.
Would you restate your motion?
Where's my motion? Okay. The Beaufort County Commissioners are opposed to the teaching of critical race theory in the public schools.
In Beaufort County schools.
First paragraph, public money.
Yeah, right here. That's the motion.
It's up here.
Oh, that's the motion right there. And so it's just the Beaufort County Commissioners oppose the teaching of critical race theory in our public schools.
Stan, do you agree that did you second the motion?
Yeah, I do, but the thing is, if we discover that it's happening, we better be prepared to at least put some teeth in it at some point.
They say it's not in the state curriculum. I think what happens when it shows up is that we have maybe a rogue teacher that's just testing the waters to see if they can get it through.
Well, Randy, it is slipping through real hard. You've got a lot of people very politically active right now, and they're not real smart, and some of them are in the education industry, and our children are suffering because of it.
So, well, along those lines, I think the Superintendent Cheeseman said it best when he said the only way I really know what's being taught in the classroom is when I stand outside the classroom and listen. So from that standpoint, we're talking about public pressure on the school system to not teach this. And if we find out certain teachers are teaching it, then we know where the problem is and we know what to do about it.
I like your changes on your motion.
Any other discussion? All right. All those in favor of the motion, raise your right hand. Those opposed? Thank you.
You knew that would happen.
I don't know why. Racist thing.
All right.
It's teaching segregation.
Item number 7, oppose the mandatory face mask.
Well, the health director gave us a real good report on why we need to pass this particular resolution. And what it says is, whereas the risk of loss of life by those in the population who are less than 65 years of age is presently minimal, that's true. Vaccines to combat the COVID virus are available to all citizens above the age, I have 18, but I found out it's now 12 years. And whereas more than 95% of the small number of people in the population who now contract the COVID disease and are hospitalized have not been vaccinated, and I think he said it was 94% when he was in here. Whereas decisions about personal health practices and protection from the COVID virus are a right of the individual citizens. This is a personal decision. I don't fault anybody for not wanting the shot. I don't fault anybody for wearing or not wearing the mask. That's it. It's a personal decision, and people shouldn't be discriminated against because they make their personal decision. Therefore, be it resolved, the Beaufort County government is opposed to the mandated wearing of masks by any population or part of the population. And one of the reasons that I brought this particular resolution up is because of what's going on in the public press at the moment. They're trying to stampede us into being terrorized about what's going on. And when you look at the statistics and the numbers, you find out that there is literally no truth in what they're saying. So we need to take a stand on this before, and let people know where we stand before governments start trying to impose this stuff on us.
Hood, got a question. Where you say mandated wearing of masks by any population or part of the population, as you well know, Biden has already said that, no, that's right, that was vaccine. But you've got companies that are going to require masks, and you're saying any part of the population? I mean,
well, it says that we're opposed to it. This doesn't mean that there's no force of law in this. There's no punishment from this. This is our opinion. We don't want the whole population put under a mandate. Now, if somebody running a business decides in order to come into my business you have to wear a mask, I don't fault him. That's his business. He can do whatever he wants to. But as a general policy, what I'm afraid of, quite frankly, as the President of the United States is going to wake up tomorrow morning in a stupor, one of his stupors, and decide that everybody needs to wear a mask every day, everywhere. And we need to be pushing back on that before it gets started. That's the main thing I'm interested in. It's still a matter of personal choice. And if you're a business, it's a matter of your choice running that business as to what you want to do and how you want to run it. I carry a mask with me almost everywhere I go. So as a courtesy, if other people are wearing it, I'll put it on. If a business says you need one to come in here, I'll put it on. But it's a personal decision, and we need to keep ourselves free under the Bill of Rights because it was almost torn away from us in the last 2 years by the actions of a lot of government officials.
Okay.
Got a motion?
Yeah, that was a motion.
Second.
Motion and second. Any more discussion? Okay. All those in favor of the resolution, raise your right hand. Those opposed? 5-2.
That was my Bill of Rights, man.
Okay, we're down to closed session. David or Katie, will you read us into the closed session?
Motion's needed to go into...
Excuse me. You can stay in here. We're going to go in the conference room. So...
A motion is needed to go into closed session under NCGS 143-318-11A3 to consult with an attorney employed or retained by the public body in order to preserve the attorney-client privilege between the attorney and the public body.
I will entertain a motion for us to go in. Okay, a motion and a second. Second. All those in favor, raise your right. I'm sorry.
We got to name the lawsuit.
Okay.
I apologize. That would be for Beaufort County versus AmerisourceBergen Drug Corp. Et al. No, do I have to read all that? U.S. District Court, Ohio, under NCGS 143-318-11.
Okay. All those in favor of the motion to go into closed session, raise your right hand. Okay. Need a motion to come out of executive
So moved.
closed session. Second. Okay, all those in favor, raise your right hand. Okay, in the closed session, we had recommendations on 4 different parcels where the previous market value had been changed or has a recommended value by our tax assessor. Need a motion to ratify the recommendations.
Motion to approve.
Motion. Second. Second. Okay. All those in favor, raise your right hand. Thank you. I will entertain a motion to adjourn. All right, all in favor, raise your right hand.